Retake? Ready? What specific issues in nursing and healthcare does it address?
I'm glad you asked that question. Traumatic stress and stress injuries have become a significant concern, most certainly over the world events of the past 10 years. Traditional disorder and illness-based approaches to trauma and life stressors and their associated treatments really focus on impairment or disorder and not prevention. And by having a discourse around stress injury, around being able to train nurses, EMTs, peers, how to recognize a stress injury and provide stress first aid is a potential significant game changer in the realm of health promotion and mental health promotion, particularly in response to disasters and traumas. It's important that we also recognize that people can have a stress injury with significant functional impairment but not be ill. And the activation of individual, family, and community resources to address those injuries is often more beneficial or a critical first step before clinical services.
Great. So what would you say is the significance?
Well, the significance of the work that I've done, particularly around stress injury, the recognition of stress injury and stress first aid, is that this is one of the first times in the history of mental health that myself and my other colleagues that have been doing this work are really talking about mental health and mental health promotion, about the strengths that individuals bring to their life experiences, and those resources that we tap into that often gets labeled as resilience. But it's more than just bouncing back. It's about engaging individuals, well, it's about recognizing when a stress injury has occurred and then engaging those individuals in a mindful and purposeful way that is helpful and hopefully not hurtful.
What are the drawbacks to the current models of mental illness treatment?
Well, the current models really tend to focus on disorder and that a certain criteria of impairment needs to be met before clinical services are started. And when we talk about community mental health and early interventions, it's not always about people who have a disorder, but for people who are really struggling and who are in an early stage of maybe beginning to use some coping strategies such as alcohol, avoidance, anger, that may very well end up leading to disorder. But it doesn't help us necessarily engage people in a prevention mode when maybe a little bit of intervention, a little bit of difference can have a really big impact.
Great, thank you. What is the impact?
Well, so far the impact of the work that I've been doing around stress injury and stress first aid is twofold. One, on a large organizational scale, the Department of the Navy, meaning for all sailors and all Marines, have used the concepts of a continuum of stress, of principles of stress first aid, as a way to begin a discourse, as a way of training and engaging peers, leaders, medical personnel, and mental health professionals all together in a way that's about conserving those individuals who are temporarily impaired because of stress. Additionally, other organizations, firefighters, law enforcement agencies, have begun to recognize that the stress continuum model and stress first aid helps to fill a critical gap in their employee and occupational stress resources, because they're professions that deal with traumatic stress and exposure on a regular basis, and not everything that they do or experience is a critical event. And if we're only waiting for events that may cause an impact on someone, then we're missing things like moral injury, we're missing wear and tear, fatigue without adequate resources, we're missing loss, and then we're also missing the combined effect or the cumulative effect of traumatic stress exposure. It may not be the first, second, or third issue. So we're seeing an expansion of what was started as really a focused way to have a discourse around stress and coping and early intervention for service members in time of war, expand across the nation to include those individuals in our own society that occupationally have some significant stressors. The other thing that I think we can also be mindful of in nursing is that nurses as a profession have multiple exposures around traumatic stress, loss, moral ethical dilemmas, and fatigue. And that as a profession, we need to be mindful about our own exposures to potentially injurious aspects of the work we do, and how important it is for nurses to have a peer skill for reaching out to each other. Because true nurse to nurse colleague helping colleagues occurs at 2 in the morning on the night shift. It doesn't happen in a conference room or at a training session. It really happens between peer to peer.
Great, thank you. How does this relate to the state and national policies and priorities?
That's a really good question, and the work that I've been doing most certainly dovetails with the local, state, and national debate around mental health, mental illness, access to care, what happens when individuals who have stress injuries but may not have a disorder act on those impulses. How many times have we heard in the news that there's been a traumatic event and everybody says, that really wasn't like that person. We really didn't expect that. But yet, when the story unfolds, we often see issues around either a traumatic event or loss, parent, divorce, feeling ostracized from the community, moral ethical dilemmas, a sense of betrayal, or even fatigue. Young men and women that I can't take this anymore and act out. So what would it mean if, as part of our national and our state dialogue, that we not only talk about increasing the number of beds, increasing the number of mental illness-based resources, but that we also start doing and talking about community mental health outreach. And nurses, and psychiatric mental health nurses in particular, are in a really good position to weave the principles of stress first aid into our discussions with families, with patients, with community members, with teachers, with firefighters and police. When we do an outreach to a community and we're taking blood pressures and we're doing health teaching around diet and exercise, should we not also be doing instruction and teaching around stress mitigation, and stress first aid? So I think the implications of this is really within the realm of mental health promotion, not just mental illness care.
Great. So what advice do you have for the next generation of nursing leaders?
I think for the next generation of nurses and nursing leaders is that this is a marvelous time in nursing. Nurses And people who choose to become nurses, using the vernacular from the military, are truly an all-volunteer force. These are bright, motivated, intelligent women and men that have the ability to choose any number of fields or paths within their life. And yet, there's a passion. There's a passion for making a difference in the life of other people. That a good day is a day that we know that we've made a difference. And part of the magic of nursing is that we get to have those days on a regular basis. The trick, of course, is recognizing when we've had one of those moments, when our passion to care, our passion to engage, connects with a patient, a family, maybe another nurse, a colleague, a technician, an aide, a physician, and through that passion in our science and our knowledge, that we made a difference. Not only a difference in that moment or a difference in that day, but very often a potential difference in a life. And we may never even know the impact that we have had on someone in their life.
Great. Thank you, Dr. Weatphal, for meeting with me.
You're welcome, Michelle, and thank you for the invitation.